Welcome back. We're going to finish off the beach flowers in this section, which is everything must come to an end. And we've actually just got two more flowers to do. And the first is vervain. And with vervain, just having a look at that flower, what you may notice is like the stem of that the flowers are growing from is really tall, really rigid, really upright, really firm. And the flowers, there are lots of them, they're kind of looking in all directions. But there's a softness to those flowers, which is kind of in contrast to that really rigid stem. The colour of like a soft lilac-y or pinky kind of colour, the soft petals, small flowers, everything about it is softening. And vervain, out of balance, is very rigid in thoughts and ideas. But unlike something like rock water, where there is rigidity, but it's more kind of aimed at the self, vervain is looking to convert other people to their vision, to their ideals, to their state of perfectionism. And they introduce this into lots of different conversations. And they're fixed principles and they're grand plans for the world at large. And they solve world problems, and or it can be in their little sphere, in their work, for example. Nobody else can see what needs to be fixed, and I have to go in there and do it and fix it and show other people and be this beacon of rationality and sensibility and cleverness and rightness. And so vervains, as a consequence of kind of always putting themselves forward as being right, as being a state of perfectionism, ends up being incredibly highly strung, incredibly, they kind of hold a lot of tension in their bodies. They're trying so hard to maintain that rigid stance that they kind of become very rigid. There's no flexibility in the way that they think, and there usually is no flexibility in their physical body either. It's a reflection of a state of constant tension. The lesson of vervain, however, is to calm, is to relax, is to breathe, is to find tolerance, but to recognize that the softness of those flowers from that kind of rigidity of the stem, that softening and that opening holds such wisdom. When we talked about with a lot of the ones from this session, the importance of finding a way to relax, finding a way to be flexible, finding a way to go with the flow. And sometimes it can be through moving the physical body that eventually filters through to the mind and the emotional state. Or you can start really at the emotional state and filter it back through to the body, or do both. So it may be something to think about when you meet a vervain type in clinic. That softening aspect, rather than something that's going to continue with their ideals of perfectionism, something that's about flexibility, something that's about freedom, something that's about no construct and no rules, for example, like free dancing or painting with your left hand in all different colors, or something that moves them out of that analytical need to find perfectionism and to find the ideal. And vervain types, when they're really out of balance, can be intense people to talk to. They often talk at you, first of all, And they find ways to move whatever conversation is happening back to their views on whatever high horse they're on in that moment. I hope that word high horse makes sense to you. Whatever mission they've decided is theirs for the moment, that they need to start converting everybody's way of thinking to theirs. So they'll use terms like, well, the reality is, or yes, I hear what you're saying, but actually this is right. And usually what that means is, I hear that you have decided to talk. I didn't necessarily listen to what you're saying because this is correct, and I've analyzed this, and this is the way that it is, the way the world is. Another interesting lesson for Vervain, aside from accepting that there are so many different ways of being in the world, so many different ways of going about finding your own ideal, your own goals, your own personal journeys, is that being is just as important as doing. So Vervain types, when they are out of balance and they get exhausted, they feel themselves slipping away, they will throw themselves into this ideal twice as much, and they end up with often a lot of physical pain. It's like their body is trying to get them to slow down and get them to just be. And Vervains don't necessarily always want to do that. So a Vervain in the positive, like a lot of the ones from this session, are actually leaders, and they have an incredible gift of communication a lot of the time. And when they're in balance, they can inspire greatness in other people. They can, when they recognize that kind of everybody's path is just that, another person's path, they can really help to inspire that person to continue along their own path. That's the Vervain in balance. They can be spiritual leaders in some ways, rather than getting kind of bogged down in dogma and in things that aren't really serving that individual, but deciding that that's the only way, the right way, and you just need to sit down and listen because I've got it all sorted out. When they can soften and they can listen with compassion, they can inspire. And chicory, this is such a heavenly blue. There's such a cooling quality to this flower. It's also, it just speaks to me of this otherworldly sort of blue. Like, it's not quite real. It's quite a beautiful flower, and because it grows everywhere and it's a bit of a weed, people don't necessarily always look at it and look for more exotic flowers, but this is such an example of beauty in nature. And chicory is known or is used in the Bach flower remedies for possessiveness. And what a chicory type is looking for is love. They're looking for a way to give and receive love. It's mostly about receiving love. There's a fear that there isn't enough love, or that they aren't worthy of love on a deep level. And so they set about trying to manipulate and kind of own that love. And if we look at the different flowers that we've gone through, and what you'll notice is that all of these flowers are that seeking of love, and this one is about I love you, I cherish you, and therefore I own you. So it's a very there is condition on the love. I need to do everything that I can to kind of keep you near so that you don't leave me. And there's an intense fear of abandonment oftentimes here. There's usually feelings of powerlessness, and so the way that that's dealt with is to try and control and manipulate. And oftentimes it will create codependent relationships where neither party is happy, but the story that they're stuck in, the story keeps them there. The belief that this is as close as there is to love. So they may pair up with like a century. Remember the doormat remedy? That's an example of a kind of codependent relationship that may occur. There's many of them. That was just one example. And so chicory, the ultimate lesson of chicory is really in unconditional love and the extreme vulnerability of unconditional love, and being comfortable in the reality of being human, which is you can't control a situation to ensure that you will always be happy, that you will never be in pain, that you will never experience loss, that everything will be well at all times. Some people have that as like a spiritual ideal as well. Once I become enlightened, I'm not going to be affected by this humanness. But to truly embody that spirituality, to truly embody what it is to be human, is a spiritual goal in itself. And unconditional love and the ability to take that love, give it where it's needed, and expect nothing in return is one of the ultimate lessons of chicory. And it's, in a lot of ways, a spiritual ideal. So selfless care and concern for others. This is moving out of the need to play manipulation and power games in life situations. And perhaps you've seen this play out in family situations, for example. If there's a controlling or manipulative parent, somebody that says, I gave you life, so therefore you owe me. In work situations where it's I am your boss and therefore you need to show me respect, and you need to be my friend, and you need to provide me with love and nourishment. Whilst that may not be articulated, that can be kind of an undercurrent of chicory. And chicory comes from a place of truly wanting to give and receive love. It just becomes distorted when fear of not being lovable is such a strong undercurrent, such a strong story that they're telling themselves. And so that fear leads to desperation, and that desperation leads to manipulation. And so you see lots of various ways of distorting. The second last one there, feigning illness to gain attention, that's a good chicory one. And you see this actually in manipulative parents. It's a good example of this, where parents will fake illness, particularly pain, for example, to try and get love and get attention and get energy from those around them. Of course, it doesn't have to be a parent. I'm using that as an example. It can really be anyone. And then rescue remedy. Now, rescue remedy, you can see from this picture there are many different ways that rescue remedy are now sold. It used to simply be in the dropper bottles, but people have since put it into sprays, balms, creams, and pastils, which are like kind of little sugar lollies. It's a way of showing how versatile rescue remedy can be if you choose to use it. And there's nothing stopping you from using the dropper bottle of rescue remedy or making up rescue remedy from the 5 essences that you will learn about and putting them into your own creams and sprays, etc. for your patients. Okay, so rescue remedy is with Star of Bethlehem, Rock Rose, Impatiens, Cherry Plum, and Clematis. And I just want you to take a moment and try and remember, if you can, what these remedies are for and how they may relate to stressful situations, emergencies, or accidents. And while you're thinking about that, I just want to tell you a little bit about the supposed origins of rescue remedy, which was that Dr. Edward Bache was at his seaside retreat, and there was a large accident with a boat, and 2 sailors were at sea for a very long period of time, and they eventually got rescued, and 1 man was brought onto the shores and was kind of delirious by this stage because he'd been at sea for so long in pretty horrific storm conditions. And Dr. Bache, being a medical doctor, was on scene to help, and he chose to mix these 5 remedies together and place them on the lips of the by this stage delirious man. Supposedly within moments the man woke up and all was well. And whether that's a story and a myth and that's been exaggerated over time or not, that's supposedly the beginnings of rescue remedy. So how did you go with the 5 remedies? Star of Bethlehem, if you remember, that's that beautiful white flower that's really open, and I gave you the example of the doctrine of signatures of the triangles, one to the heavens and one to the earth. It's for shock and the dissociation that can happen with shock, and it addresses cellular memory with shock, and also feeling kind of not quite in the body after shock. So it's to help bring people back into the moment. Rock Rose is for terror and panic. Impatiens, and so there's 2 there for terror and panic and desperation. So one is Rock Rose and one is Cherry Plum. Cherry Plum was different, if you remember, because it was like feeling like you're on the knife's edge, like you're unable, you feel out of control of the situation, and there's desperation that comes with that state and a panic that comes with that state. So the 2 of them are to address terror and panic, which can often occur with people. I'm not sure if you've been in an emergency situation before, but some people respond in quite a panicky, terror-induced way, and they often get in the road of emergency personnel trying to do their jobs. I've certainly experienced that a couple of times as a first aider, and having to kind of forcibly hold somebody down to keep them away from emergency personnel. Impatiens for mental stress and tension. So this is for when people can get incredibly, the stress of a situation can kind of heighten and worsen the effects of the situation. So it can kind of become much bigger than it needs to be. So this helps to center and calm somebody so that their mind doesn't kind of run away with them. And then Clematis or Clematis, which works really well with Star of Bethlehem. And Clematis, as you remember, hopefully, was the one that grounds someone. So for people that tend to be off with the clouds or in a shock situation, they're not quite here, not quite responding very well. And some people in an emergency situation will just totally freeze. They have no idea what to do. I remember one year I was doing first aid, and the example was given of a medical doctor who was watching his 2-year-old daughter drowning and completely froze and completely forgot what to do in that situation and had to call emergency personnel despite having learnt how to save his daughter. There was such a strong emotional connection, obviously, and a fear response that it created a frozen-like state. And so this is to help bring someone back so they can refocus and re-engage in the situation. If you remember back when we did dosage of the beach flowers, Rescue Remedy was the different one. So usually it's 2 drops from the stock bottle. With Rescue Remedy it's 4, and of course you can, like I said, add this to anything. Now, here's this last point. If they're unconscious, you can give nil by mouth. That's unless you are a medically trained professional, there is no way that I would personally suggest putting anything on anybody's lips or gums if they can't give you permission. That is not a legal thing to do. So I would be less inclined to do that. I do, however, carry Rescue Remedy with me, generally in my bag, just in case, and I've certainly got one in my first aid kit, but always with permission. So these are a couple of examples of how to apply Rescue Remedy externally, just giving you some ideas for various types of applications, not just for Rescue Remedy. Remember, this can be for any of the essences that we've done and any essences that you will continue to cover in your time as a therapist. And Rescue Remedy really is for moments of emergency, or when there's great sorrow, when there's overwhelm of an emotional state, when there's sudden bad news, or after an accident. I would also put in there that I have used it when somebody is taking a remedy mix and they're taking it for something specific, but every now and again everything just seems far too overwhelming, and they move into states which are just nothing's moving forward. It's kind of freezing them in that state, and Rescue Remedy can be really useful for kind of bringing people back, and for in those moments of feeling overwhelmed, if they're really not coping with it, even if it is part of the healing journey, Rescue Remedy can sometimes be really helpful, just to bring someone back, bring someone into focus, and then they can move forward. And of course you may have seen it being used in exam time, perhaps in your studies. Students choose to use it just as a way to focus in the exam, to kind of regather their thoughts, and particularly if stress and anxiety takes them into a space where they go blank, for example. So that is it for the beach flowers. Now that you know all of them, we're going to pull them together in one big case study. So what you're going to do is read through this case study, and then you're going to create a timeline, much like you would do with your clients, much like you've been trained to do. And in that timeline, start to think about and put into place the therapeutic order. So where you might address some of the important parts of this case study in order to treat. Next, you're going to come up with a flower essence prescription for the patient, and it's going to be an acute remedy. So how would you dose that differently to a chronic, like a constitutional style remedy, for example? Then I'm going to get you to explain to this person as though, like, write it as though you're explaining it. Write it in language that makes sense to you, that you would actually use. Explain what you've prescribed and how they will help. And it may even include what flower essences are and how they work. So what this patient can expect, for example. Pull all of this information together and start to help it make sense on a very practical level for you. It'll help your learning. So that's it for kind of the first part of flower essence therapy. We're going to move now into the Australian flower essences, and we're going to teach them in a slightly different style. So hopefully Beach is making a bit of sense in your head, and hopefully you're engaging with each other online about your learning. Thank you very much.